Hello and welcome to the Fact Factory podcast, where we dive deep into the truth and trend shaping our world today. I'm your host Ishmael Chimaza. So, in today's episode, we have the guest who is going to tell us what are the STIs and why most of the youth are acquiring STIs and some preventive measures of these STIs. Welcome, Maria Cavar. So, what are the STIs, or how can you define the sexually transmitted infection diseases?
Okay, sexually transmitted infections are infections that are spread through sexual contact, including vaginal, anal, or oral sex, skin-to-skin contact, and sharing needles and syringes.
Okay, so can you tell us what are the most common sexually transmitted infections that you have seen here as a nurse?
The most common STIs I have seen are chlamydia, gonorrhea, syphilis, herpes, human papillomavirus, and HIV.
So, can you explain to us how does these sexually transmitted infections affect people, especially the patient?
These STIs can cause symptoms like pain, urination, abnormal bleeding or spotting, itching or burning sensations, fever, chills or flu-like symptoms, skin lesions, or rashes.
Okay, you have explained a lot there. So, can you tell us how does these sexually transmitted infections can affect someone mental health? As you already know that maybe someone can be stressed with these diseases, maybe worrying about it. Why is this happening to me? Can you explain to us some of the impact of sexually transmitted infection on mental health of people?
These STIs can impact mental health by causing anxiety, depression, or stress due to diagnosis or presenting complaints. It can also impact mental by leading to feeling of shame, guilt, or embarrassment.
So, how can we give support to the patients or the one who is suffering from these STIs, including HIV and AIDS? How can we provide support to those people?
Alright, we can give support by educating them on STI prevention and its management. And we can also give them counseling. Yes.
Okay, so can you tell us what are the best ways of preventing these sexually transmitted infections?
They are the best ways to prevent sexually transmitted infections. These are by using condoms consistently and correctly. When people are having sex, they have to use condom correctly. If they do so, the best way to prevent STIs are by using condom consistently and correctly. Because when using the condom correctly, it cannot burst. Therefore, they cannot contract STIs. By avoid sharing needles and syringes or injectable equipment. Yeah, for instance, when you are caring for someone who has infections like HIV, the healthcare must be careful when caring that patient, because he or she can easily contract HIV. When you are caring a patient who has HIV, it is it is a must for a healthcare provider to take care of herself, his or herself, because, for instance, those who use drugs, they are likely those who abuse drugs, they are likely to contract sexual transmitted infections because they can use one syringe. So if they avoid to share those instruments, they can prevent STIs. Another way is being faithful with one partner. People are being faithful with one another, they cannot contract STIs. But if they have multiple partners, they are likely to contract sexual transmitted infections.
So can you tell us, does the sexually transmitted infections affect relationship? When you talk of people who are staying together as a woman and a man, or the youth who are in a courtship. Okay, anyway, does the sexually transmitted infections affect the relationships?
Yes, STIs can affect relationships because it can cause mistrust in a relationship. The one cannot trust his or her partner. Maybe one can be faithful, but his or her partner is unfaithful. Yes. So the one who is faithful and is having these STIs, he or she is likely to know that these infections I have this one because my partner maybe has another somewhere. So he or she, this is so because when someone is faithful in a relationship, and one partner is faithful but another one is unfaithful. So if they both have these infections, one of these infections, the one who is faithful is likely to mistrust his or her partner because he or she is having multiple partners. Yes. He or she is likely to contract STIs and give it to his or her partner who is faithful. Yes. So if they both realize that they have infection, the one who is faithful cannot trust his or her partner. Yes. Yes.
Okay, so what advice would you give to the people who are dating, or the people who are in marriage, about these sexually transmitted infections? What advice would you give them?
Okay, the advice I can give to them, I should advise them to discuss about STI testing and history. I can also advise them to practice safe sex, establish boundaries and expectations, seeking counseling if the need arises.
So can you tell us what are the most STIs symptoms that the people mostly miss?
Alright, yes. Most of the times, common symptoms that are being missed are mild or asymptomatic cases, unusual discharges or bleeding, skin rashes, or flu-like symptoms.
So, as you already know that some patients might not be open in sharing what they are suffering from, maybe just because of stigmatization or shame. So how do you help these kind of patients in terms of providing the medical support?
Okay, this patient can be helped to overcome the stigma by providing non-judgmental care. A healthcare provider must provide a care with a supportive attitude, not by judging him or her that about his illness. Yeah. Educate them on STI facts and statistics by making them to understand what STIs are. You can also refer them to support resources, for instance, counseling, support groups.
So can you tell us why STIs testing are important for the people?
Okay. It is important to go for STI testing because it can detect asymptomatic cases. For example, a person can live for so many years not knowing that he or she is having infections.
Yes.
So if they are being detected in their bodies, they can be given treatment to prevent some complications.
So how often does the person required to test for the STIs?
STIs should be often be tested every 3 to 6 months, or it can also be tested when one is being exposed to a new pattern. Or even those who are at risk of contracting STIs like prostitutes.
Yes.
Those people should go for testing regularly.
So why do people or their loved partners they should disclose their status to their loved ones, and how is it important?
Okay. It is important for a health provider
Yes.
to advise that patient to disclose his or her illness to his or her partner by educating him or her. It is a duty of a health provider to advise that kind of patient to disclose that he or she is having that illness to his or her burden by educating him or her on STI facts,
Yes.
and how you can contract them and its management and its impact, so that he or she can able to disclose it to his or her partner, so that they can all get treatment.
So what advice can you give to the young individuals as well as the youth about the sexual transmitted infections?
Okay, I can advise them to practice safe sex by using condoms, get vaccinated. For example, hepatitis